Thank you very much for humbling me by this invitation. Oh, go backwards. Anyways, yeah, thanks for having me. This is great. You know, when we first started doing left atrial appendage work, I was literally traveling all over the country and all over the world. And when I first started it, I was traveling to educate people on the concept of closing the left atrial appendage, but I immediately realized that 85% of the people I was talking to didn't even know what an appendage was. So my talks quickly changed into first educating people what an appendage is, and then subsequently what the concept of closing it is. But we've gone from that to now talking about which device we're going to use, which is very pleasant to be in this field. Fortunately, my talk tonight doesn't have slides and data, so it's purely opinion, so it's going to be more fun, hopefully. So the way I look at these devices that are currently on the market, it reminds me of cell phones. I remember when the Razor first came out, I was actually a first-year fellow in cardiology, and I thought it was the greatest thing mankind had ever made. I signed up for it before it even was released. I was the first one probably to buy it in New Haven, Connecticut, and it fit in your pocket. It was beautiful. I loved it. I thought nothing would ever beat this phone. Well, I've just ordered the iPhone 16 Max Pro, which is significantly bigger. It should be at my house tonight, and now we're using these. I'm quite certain 20 years from now, some fellow is going to be standing somewhere talking about those idiots back in 2024 who were using iPhone 16 Max Pros. But that's what the left atrial appendage world is. So, you know, the first device that came out, as you know, is the Legacy Watchman, which had a lot of flaws. But when we were first using it, and they came and said, hey, we want your opinion, come test out some of the next generation ones we're going to have, I was thinking to myself, oh, goodness, this is such a nice thing. How are you going to make it better? This is so good. But here we are 10 years earlier, and 10 years later, and that was a horrible device. Our devices currently are remarkably better than they were with the first device. So shortly after that device, Abbott put out the Amulet device, which, as you know, looks like that and has, let me see how this mouse works, you know, these anchors. So when the Amulet first came out, the whole notion of being able to create a ball and create the triangle and being able to push against the back wall of the appendage without a guaranteed perforation was a game changer. And that was really, really something that, you know, we were looking forward to. Subsequent to that, Boston Scientific put out the second generation Watchman, which had the same ball concept. And these newer devices, for those of you who aren't implanting them, allow you to really push against the back wall of the appendage, which is a paper-thin environment, without fear of perforation, which really changes the game a lot. The newest generations of the Watchman, for instance, the Watchman Flex Pro this is the Watchman Flex. The Watchman Flex Pro has a proprietary chemical on it that allows healing and endothelialization quite faster. The HEAL LAAO trial that's actually studying that in detail just recently finished enrolling, and we're analyzing the data. Hopefully we'll have that kind of information. So the field has really changed a lot and moved forward a lot in the options that we have currently. So the question here is, you know, which device do you use? When do you use it? On some level, I feel like you should use both devices because you should really have comfort level with what you're using. If you use one more than the other and don't have experience with the other and you have a challenging anatomy, this is probably not the first time to pick up the other device and try to experiment with it. You should have enough experience with both devices so that when you do meet that challenging anatomy, you know, you're comfortable with both. So the luxuries of the various devices and what they fit better, if you're trying to pick one over the other, this is just a handful of different shapes of the appendage. You know, one of the most fascinating things I find about left atrial appendage work, to be honest with you, is that very first shot of the appendage you take. It's never the same. You have appendages that are larger than the left ventricle, and you have appendages. Actually, about a year ago, I had a lady who had a congenitally absent appendage. We took all sorts of pictures. There was no appendage. We did a CTA later. Then I started asking around from my colleagues, have you seen this? And I found a couple of other people who had, you know, had patients who had congenitally just simply didn't have an appendage. So anyway, so you know, if you have a straightforward appendage like this one, you can use both devices. It's purely a function of which device are you more comfortable with. The advantage of the amulet over the Watchman is that it doesn't require nearly as much depth. So if you have an appendage that takes a sharp turn, if you have an appendage that doesn't really allow you depth, probably being able to land the lobe of the amulet there and having the disc, clearly that's more advantageous than the Watchman is. If you have a really wide appendage with room to fill, probably a Watchman would fill that area much better. So I guess the question really turns into, what are the pros and cons of the two current devices? And then I'd like to spend just 30 seconds about some of the future devices. So, the amulet, which has a lot of advantages, nothing against the device, but a couple of downfalls that has been discovered. And before I tell you the downfalls, I can tell you that the clinical trial on the next generation amulet is underway, and I honestly think that it's going to be a game changer. I can't personally wait to get my hands on the newer device. I've seen it, I haven't implanted one, but so when we first started to put in the amulet, we realized that you could have a 15-minute in and out, very straightforward, very easy case that you're very proud of yourself, and the next day the patient shows up, or 2 days later even, the patient shows up with tamponade and has a massive pericardial effusion of no fault of the implanter. So we soon discovered that that's most likely due to the thickness and the length of these anchors that the amulet has. And the other thing that has recently been shown around the country, doesn't happen all that often, but something that if you're going to use it, you should be conscious of is that the location of the pulmonary artery compared to the appendage. They're quite close to each other. And on the TEE, I don't actually do TEE, so when this data was brought to my attention, I started to ask my TEE colleagues, how easy was it for them to get these images and show us the proximity of the pulmonary artery to the appendage. And honestly, before this talk, I'd never looked it up, but before this talk, I decided to just search on it and see. Apparently, somewhere around 15 to 20% of anatomies, the distance between the appendage and the pulmonary artery is less than 1 millimeter. So the anchors of the amulet has been found to perforate or tear the pulmonary artery, which, as you can imagine, that's pretty much a death sentence, even if you have a surgeon in the room. The next generation of the amulet should really solve those problems. And I mean, I can tell you outside the body, it looks quite pleasant. I'm hoping that it's going to perform significantly better and change and those, again, these are, I've been asked to talk about the pros and cons of the two devices. This is not to say that this happens. I mean, out of every 100 or 200 that you put in, you may see one late pericardial effusion. It's not some major thing that occurs all the time, so not to be bad-mouthing the device. But then recently, both companies have a steerable sheath, which, again, when they first posed it, I wasn't 100% certain how it was going to change the game or how useful it was going to be. For those of you who know Devi Nair, who's an EP up north, who's the guru of the left atrial appendage world. So when the steerable sheaths were coming out, she told me this thing about how it's a truck and trailer thing. I've only driven a truck and a trailer maybe 3 or 4 times in my life, and I can tell you it was a disaster all 3 or 4 times. Never got the trailer where it was supposed to be. But she was trying to explain to me how you back up the truck and you turn it this way and the trailer goes that way, but if you turn the truck the other way, the trailer goes the opposite way. I had no clue what the hell she was talking about. Still to this day don't. But the sheaths, now that I've gotten my hands on them and are using them, are actually quite phenomenal. So this is, some amulet cases here, as you can see. If without the steerable sheath, this thing's going into the back wall, not really giving you much room, not a good deployment. But if you can steer it up, you can have a completely different deployment, and you can have a very nice result. And honestly, I think if you're a left atrial appendage implanter, you should start using the steerable devices on 100% of your cases. Because again, you don't want to pick up a new tool when you're in the middle of a challenging case. Because the concept that the companies are trying to sell to you is that when you have a challenging anatomy, this steerable sheath is going to help you. But I can tell you, I've used the steerable I don't know exactly, but probably somewhere in the vicinity of 50 times. And I can tell you the last week or two is when I'm really beginning to get comfortable with it. And I'm now completely understand, well, not completely, I'm now to some extent beginning to understand the whole truck trailer concept. And I see Dr. DeVay nodding his head. I assume he's had similar experiences. So if you start learning how this sheath works and how to manipulate it, it's a game changer. I mean, it really changes how these devices sit in the appendage and how you can tuck in the different corners of the device. It's quite useful, but only, and this is the Amulet, the Abbott Amulet version, and this one is the Boston Scientific version. Essentially, they do the same thing. They're just positioned a little bit differently. On the Watchman one, the steerability is here. On the Abbott one, it's a little bit farther back. It's just getting used to the two sheaths and being able to, manipulate it and learn how to use it. I'll try to hurry up because I think I'm past my 7 minutes. But real quickly, I want to talk about just to show. So this is the Conformal company, has this device called the Class device. It looks a lot like the Watchman device. It has this foam-like material that covers the entire thing, and it's got this covering which promotes the endothelialization. Rather than a stiff rod, it's on a string. The concept of the foam is that as it hits the blood and expands, it'll fill all the gaps and areas that the Watchman can't cover. So that's the downfall of the Watchman, right? If you do the Watchman, there's always, if you do a CTA, there's always 1 millimeter, 2 millimeter leak here, 1 millimeter, 2 millimeter there. If you do a TE, you don't get to see those very often, but if you get a CTA, there's often a millimeter or 2 leak here and there. The clinical relevance of a 1 or 2 millimeter leak versus a 3 or 4 millimeter leak is very different, but this device, their concept is that it'll eliminate those. And the first, I believe, 200 or 250 that we've implanted in the study worldwide has given us enough experience that the company is actually on the second generation of their sheaths and on the second generation of their device actually for the remainder of the trial, which the question becomes how thrombogenic is this material, how well is it going to do long term? But I can tell you on the ones that I've implanted, they actually look quite nice. It's follow-ups out to 1 or 2 years that we have so far. The device looks really nice. This device, which is the laminar study device, which I have not gotten my hands on, but theoretically I can't wait to see what the results of the trial is. This metallic structure at the end of it is what they call the ball. You advance that just like you advance the Watchman or Amulet ball into the appendage. You turn the entire device, which literally twists the appendage on itself and twists the ostium, and then this star looking device at the end pushes in and anchors the device and the appendage in a twisted format. I've seen a few implants. They look really good. How thrombogenic again is this metal going to be long term? What does this mean in patients who've had a sternotomy and have fiber tissue there and so on and so forth remains to be seen. But, as a left atrial appendage guy, anytime somebody puts one of these on the market, I'm personally super eager to get my hands on it. I know Dr. DeVay probably feels the same, but I'll stop there because I know I'm past my 7 minutes.